Continue what we are talking about, the bone protrusions. Various bony protrusions throughout the skeleton contribute to each bone unique shape. For example, the head of the humerus of the femur contains two primary protrusions, greater trochanter and lesser trochanter. A trochanter or protrusions is the site of muscle attachments. The anatomical purpose of area of bone swelling are to strengthen the bone in that region and provide greater contact surface for the muscle to attach. Throughout the skeleton, this area of increased bone formation go by different names depending on the bone on which they raised. For example, the upper humerus has two protrusions, greater tuberosity and lesser tuberosity, that serve as attachment point for the rotator cuff muscle. At the lower aspect of the humerus, the protrusion by the elbow are called epicondyles. Moving further down the body, protrusion of the upper femur are known as trochanter. Now we will move to talk about blood and nerve supply of the bone. Even though bone are not actively growing longer in adults, they still require a constant blood supply. Bone receives its blood from three sources: periosteal vessel, nutrient arteries, and epiphyseal vessels. These three vessels ensure that blood is available in all area of bone, from the innermost spongy bone to the outer compact bone. The functional unit of compact bone consists of osteon or Haversian system. These vertically stacked units each contain a nerve and one or two blood vessels. Trabeculae are functional unit of a spongy bone that consists of network of plates and rods. Because spongy bone is less dense than compact bone, it contains a richer source of blood vessels. Not only do bone have a rich blood supply, they can also sense pain. One primary source of bone pain is from periosteum, the outer covering of bone that contains pain-sensitive nerve ending. Therefore, we will now discuss the important connective tissue within joints that diminish the pain signal, which is the cartilage. Cartilage structure and function. Articular cartilage is a connective tissue covering at the end of long bones that provides smooth bone contact in freely moving joints. When the cartilage is degraded or lost from overuse or aging, bone-on-bone contact results in pain and stiffness at the joint. Because osteoarthritis is a common problem with athletes and older population, a true understanding of the structure and function of cartilage is important for any trainer or therapist. As mentioned earlier, bone can sense pain. The periosteum and endosteum covering of bone contain pain-sensitive nerve ending called nociceptors or nociceptors. Because joint motion should not be painful, articular cartilage cover the end of moving bone to lock the spine, the pain signal, and reduce compressive stress. Importantly, articular cartilage is just one form of cartilage in the skeletal system. Collectively, cartilage is a type of connective tissue made up of dense collagen fibers embedded in a firm gelatinous substance that gives its consistency of plastic to provide tensile strength while still being more pliable than bone. Let's cover the three types of cartilage. Hyaline cartilage. The deformable but elastic type of cartilage is the most widespread form in the body. It's located in the nose, trachea, larynx, bronchi, at the end of ribs, and the end of bones of many freely moving joints in the form of articular cartilage. This is the hyaline cartilage. Second one is the fibrocartilage. This tough tissue, so this is tough than the preformed one, is located in the intervertebral disc and at the insertion of tendons and ligaments. So on the ends of ligaments and tendons there is fibrocartilage. The elastic cartilage, as the name implies, this is the most pliable form of cartilage. It gives shape to the external ear, the auditory tube of the middle ear, and the epiglottis. In addition to being a barrier to pain, cartilage also play an important role in bone development. Indeed, most bone begin in a cartilage, and then the cartilage ossify as you age to become the hardest connective tissue in the body. A newborn baby has the softened bone since it contains the greatest percentage of cartilage. Throughout development, the bone becomes progressively harder as cartilage is replaced with bone. Once a person reaches full development, The only remaining cartilage in bone is articular cartilage to protect bone-on-bone contact, along with the epiphyseal line near the joint. However, not all cartilage is gone by the time a person reaches adulthood. Indeed, cartilage is a part of the adult skeleton and it provides important role at specific joints. For example, the knee joint contains hyaline cartilage to protect against painful bone-to-bone contact. Unlike bone, cartilage does not contain pain signaling nerve ending, and since hyaline cartilage is deformable, it reduces compressive stress at the joint. When the hyaline cartilage is lost from aging, compressive stress, or disease, the joint space narrow and unprotected bone can contact each other. Osteoarthritis occurs when the loss of cartilage in the joint space results in pain and stiffness from bone-to-bone contact, and most commonly occur in the knee, hands, hip, and spine. Unlike other types of tissue, cartilage does not have its own blood supply. Therefore, it's very slow to heal, and the body usually cannot replace it when it's lost. Now let's talk about ligament structure and function. Ligaments are 70% water, with the remaining 30% made up of dense fibrous collagen tissue. Type 2. The strength of a ligament is primarily derived from type 1 collagen fiber that resist strain. Ligaments also possess a little bit of elastin, an important elastic protein found in all connective tissue that allow those tissue to regain its normal original shape. Without elastin, all connective tissue would stay deformed after being stretched. Skin also contain elastin, which allow it to bounce back after you pinch it. If you ever sprained your ankle, you learned the important role that ligaments play. When unexpected movement results in a torque that are beyond the ligament tensile strength, damage ensues. Nevertheless, the rules of ligaments to go beyond resistant damage. Ligaments are responsible for attaching bone to bone, passively stabilizing and gliding a joint, resisting excess movement at the joint, and allowing the brain to sense the position of the joint in space. The location of a ligament can be extrinsic, intrinsic, or capsular with respect to the joint. As the knee joint contains all three types of ligaments, let's go over each form and how each contribute to knee function. The extrinsic ligament, this type of ligament is located on the outside of all the joint. An example of the lateral collateral ligament on the lateral side of the knee to resist varus stress. Intrinsic ligament, this ligament is located inside the joint. The ACL and BCL are situated inside the knee joint, resist anterior and posterior movement of the tibia, respectively. Capsular ligament, this type of ligament is continuous with the joint capsule. The medial collateral ligament is a capsular ligament that resists valgus stress on the knee by keeping the joint approximated. Importantly, ligaments are not just passive tissue that only resists strain. Indeed, part of their function is derived by nerve innervation. The ligaments within your joints are connected to the central nervous system through a reflex pathway to communicate strain to guard against injury, and during movement the free nerve ending detect joint position, speed, and direction as part of the proprioceptive sensory feedback circuit. Now let's talk about ligament creeps, laxity, and tear. A ligament is a viscoelastic material that can return to its original shape when stretched. This allows the ligament to creep, a temporary stretch that is not harmful. For example, if you bend over to touch your toes, ligaments within the spinal column will stretch, and when you stand up, the ligaments shorten and return to their original shape. However, like all tissue in the body, ligaments have a limit to how much they can stretch before damage occurs. When a ligament is stretched beyond its structural and functional ability, it can develop laxity or tear. Laxity is permanent structural deformation due to frequent stretching of a tissue and its ends range of elasticity. Think of a rubber band that's continuously overstretched. Eventually, the rubber band will take on a new longer shape compared to its original form. When a ligament has laxity, the joint become less stable and make a person more susceptible to joint dislocation and joint osteoarthritis. A tear occurs when a tissue is stretched. In the second hand, the tear. So the first problem is laxity, the second problem is tear. A tear occurs when a tissue is stretched beyond its structural capacity. The tear can be either partial or complete. A partial ligament tear can heal with rest, whereas a complete tear usually requires surgery to repair. Ligaments have a limited capacity to heal due to their low blood supply. Indeed, blood flow to ligaments is less than that of the muscle or bone, which is why it can take months or years to completely heal. Next, we talk about the joint capsule. Joint capsule is a thin, strong layer of connective tissue that surrounds freely moving joints. Its strength primarily comes from type 1 collagen fiber, as it's also the case of the ligament. Direct beneath the joint capsule is a thin layer of synovial membrane that lubricate the joint and reduce friction during movement. Much like the ligament we just covered, joint capsule also resists excess tension at the joint. Importantly, joint capsule are innervated by nerves. Therefore, they can trigger reflex contraction of the surrounding muscle to protect the joint from damage. Joint. The human body has 360 joints. However, for the purpose of this course, there are only 16 that we need to cover. These 16 joints are emphasized because they are the most problematic area of articulation for most active individuals. Throughout this course, we'll spend much more time covering the action and function of these joints, but for now you will start to know the names and location of these joints. First, sternoclavicular joint between the sternum and the clavicle, acromioclavicular joint between acromion process and the clavicle, glenohumeral joint between glenoid fossa and the humerus, scapulothoracic region, which is the pseudo joint between the scapula and rib cage. All this about the shoulder. Next, humoradial, humoulnar, between humerus and radius, humerus and ulna, radioulnar, proximal, radioulnar distal, radiocarpal, sacroiliac, hip, patellofemoral, tibiofemoral, tibiofibrillar, talocrural, and subtalar joints. Thank you.